Thank you, Dan. Dr. Richard Blade from St Vincent's Hospital in Melbourne. Thank you for coming up, Richard, and if you could tell us briefly.
Yeah. So, thanks very much, Her Excellency, and to the Brain Foundation for the award. I'm working in the field of Parkinson's disease, and we all know that Parkinson's disease is very much thought of as a motor disorder, and we're all familiar with the tremor and the rigidity and the slow movements associated with the disease. And what I'm interested in is in the non-motor aspects of Parkinson's disease, and in particular the impulse control disorders, which are getting more interest from a research perspective. They occur in about 20% of all patients who get Parkinson's disease, and the sorts of behaviours that occur with these impulse control disorders, things like pathological gambling, hypersexuality, compulsive shopping and binge eating, and these things, as you would understand, contribute to they have a profound impact on the patient's existence. And Professor Krauss and Fung's group from the University of Sydney actually released a study a few weeks ago that demonstrated an independent contribution of these impulse control disorders to disability and reduced quality of life in Parkinson's disease. So it's a very important area. My area of research is taking a new device that's been used in Parkinson's disease, at least in Melbourne, but it's being trialled in a few areas around the world, and it's an accelerometer which measures movement of Parkinson's disease. And it's worn around the wrist, just like a watch, and it records over a period of 7 to 10 days. And it records people's off phase and on phase in Parkinson's disease. And it's very useful in terms of how the medications are working. But as a side to that, we've found that the way that patients interact with their device can predict whether they have an impulse control disorder or not. So the basis of my research is taking this new device used in Parkinson's disease to measure motor dysfunction and using it in a different way to be able to predict the impulse control disorders. And we'll be using functional MRI, which is where part of the award is going, to try and work out which areas of the brain are involved in different aspects of the impulse control disorders.